Hi, I'm Congressman Ron Kine. Congress today is debating for the 37th time the full repeal of the Affordable Care Act. I think this is foolish. I think it's a waste of time. The Senate will not be taking up legislation to repeal the bill, nor would President Obama sign it, even if it came in. The truth is this: I supported the Affordable Care Act because I believed that we had a health care system that was in desperate need of reform. And the status quo wasn't working. It wasn't working for families and businesses that were experiencing higher health care costs. It certainly wasn't working for the 50 million uninsured Americans. And it wasn't working for our public budget deficits, because health care costs is the largest and fastest growing area of spending that we have, with our federal budget, state budget, local, and family and businesses alike. So we had to do something. I'm not going to sit here and try to convince you that the Affordable Care Act is a perfect bill, but I think it gives us an opportunity of starting to reform the way health care is delivered and how we pay for it, so we get better value of care for a better price. But there's also some important features that have already gone into effect that's already having a meaningful impact in people's lives. Seniors today in Medicare can get free prevention and wellness visits without any out-of-pocket expense. It's important for them to do that in order to intercept problems before they become unmanageable and more expensive. The donut hole is being closed under the Part D program because of the Affordable Care Act. Young adults to the age of 26 can now stay on their family plans. And children with pre-existing health care conditions can no longer be denied health care coverage through their family because of that pre-existing condition. Small businesses in Wisconsin are eligible for a tax credit for the health care that they're already providing their workers. 35% this year, and it'll go up to a 50% tax credit next year. And starting next year, we're going to create health insurance exchange, a purchasing pool so that small businesses, family farmers, individuals can go in there, choose amongst competing health care plans with complete transparency so they know what they're going to get and how much it's going to cost. And it's coupled with tax credits to better afford health care for individuals and these small businesses. These are things that are real, that are happening already. And yet the Republican Party is still bent for the 37th time to try to take this away and to start from square one again. With a healthcare system that wasn't working, that was driving up costs, leaving our businesses less competitive globally, and hurting our public budget. So instead of wasting time yet today to debate the 37th repeal of the bill, we ought to be figuring out a way to how do we come together as a country again and find out what's working in healthcare reform and what isn't, and then having the ability to make changes. That's the only way this ultimately is going to work. So I naturally am a no on full repeal today, and I would encourage my Republican colleagues to start working with us on common sense steps to improve a healthcare delivery system that produces better results at a better price.